Thanks for staying with us. A study by Wits University seems to suggest that South Africa is at a COVID-19 immunity turning point. The study, published in the New England Journal of Medicine today, shows that South Africans could have extensive immunity due to high infections in the first 3 waves of the virus, coupled with the rollout of COVID-19 vaccines. While joining me to talk more about this study is Professor Shabir Madhi, Professor of Vaccinology at Wits University. Professor Madhi, good evening to you. Thanks for your time. Quite a large-scale study that has been undertaken here. Let's talk a little bit about the methodology and how it was conducted.
Good evening. Thank you for having me. So there were 2 components to the study. The one component is where fortuitously we were investigating what percentage of the population in Gauteng had been infected with the virus during the course of the first 3 waves, before the onset of the Omicron wave. And this survey, the manner in which it's done is that we selected random households throughout the province, and then we tested those individuals for antibody, and the presence of that antibody would be an indication that they might have been previously infected with the virus. And the outcome of that particular study indicated that 70% of individuals across the province had been infected with the virus at least once before the onset of the Omicron wave. In children under the age of 12, it was roughly about 60%, and in adults, in people above the age of 18, it was around about 73%. So what that already showed us is that a large percentage of the population had been infected, and from that infection, we do expect people to start developing immunity, and that immunity assists them in protecting against severe disease at least, even though it might not work too well in protecting against infection. Now, the second component of this is we then looked at what happened during the course of the Omicron wave. In terms of hospitalization, a number of people that have been diagnosed with COVID, as well as the number of people that died. And what we were able to demonstrate is that the COVID wave, due to the COVID wave due to the Omicron variant, was substantially different compared with anything that we had experienced in the past, and particularly when it came to the number of people that were ending up in hospital or that died of COVID. So if we just look at people that died as an example, what we showed that counting from the start of the pandemic, the number of deaths that occurred during the Omicron wave in Gauteng only contributed to 3% of all of the people that died since the start of the pandemic. In contrast, if you look at the 3rd wave, which was due to the Delta variant, that contributed to 50% of all of the people that died in Gauteng since the start of the pandemic. So although there were large numbers of infections taking place during the course of the Omicron wave, where vaccines weren't working too well in protecting against infection, and people that were previously infected also getting reinfected, those large numbers of infections didn't materialize in large numbers of hospitalization and deaths. So we see a decoupling of infection compared with severe disease and death, telling us that we're in a very different phase of the pandemic. And what underpins all of this is an extensive amount of immunity that has evolved, which is a combination of the effect of past infection and vaccines that were being rolled out in Gauteng and the rest of the country.
Professor Madhi, I just want to zoom in there on part of what you said around immunity and the severity of disease. So ultimately, what is the study telling us, number one, about the rate of immunity amongst the different waves and the impact of that on the severity of disease that one may have, and how does it fluctuate when it comes then to the Delta versus the Omicron?
Yeah, so what the study tells us is that there's extensive amount of immunity across the province. And now after the Omicron wave, and we are about to repeat the study, but we already estimate that 85% of people in Gauteng have been infected with this virus that causes COVID-19 at least once since the start of the pandemic. But the majority of those individuals wouldn't have known that they were actually infected or wouldn't have been investigated. And the number of cases that are reported by government, as an example, only represents about 10% of the actual number of people that were infected with the virus in Gauteng, and the same thing goes for other parts of the province. But what it also tells us is that with this extensive amount of immunity that has evolved, and like I mentioned, neither vaccines nor past infection with other variants perform too well when it comes to protecting people against infection, but both vaccines as well as past infection, and certainly the combination of the two, people that have both past infection as well as are vaccinated, they tend to have really good protection against severe disease and death. And that is what matters most when it comes to COVID-19, the number of people that are ending up with severe disease and the number of people that are dying. And moving forward, what I expect to happen is that we will have another resurgence. There might be new variants, but the future resurgence is unlikely to cause many more deaths than transpired during the course of the Omicron wave, which itself was very subdued compared with the Delta variant wave.
Professor Madi, just before I let you go then, any indication, at least through this study, how long immunity lasts?
Well, it depends what you're wanting protection against. When it comes to protection against infection and mild COVID, unfortunately, neither vaccines or past infection work too well, and especially 2 doses of vaccine don't work too well. When it comes to protecting against severe disease, the indication is that 2 doses of vaccine as well as past infection, and certainly the combination of the two, past infection plus vaccine, that works extremely well and for a long time in protecting against severe disease. The estimates currently is that protection would last for at least 3 to 5 years. But if people are at high risk of developing severe COVID, then they might require a booster dose of vaccine more regularly.
Professor Shabir Madi, thanks for your time tonight. And of course, that particular study being peer-reviewed and being among the first that presents the data around the decoupling, as you heard there, between infections, COVID-19, disease and death.